Story Turns leads workshops for community organizations, and we typically work with groups of people who don't normally tell their own stories. So the people here are part of a really amazing, scientifically, medically backed research program called Salome, and it's a heroin-assisted treatment program. So we have 11 participants who are creating multimedia stories, personal stories about a range of really fascinating personal experiences.
What's really been surprising and heartwarming is how people are so committed to writing their stories. It's so important to them, and they're so focused. They're coming in the morning, sitting right down and writing the stories, and really want to have this opportunity to tell people who they are and where they've been and where they are now. And I'm really, really enjoying that and surprised at how important it is for people to do that.
The hope ultimately, I think, is that they'll have something that is unique, that tells their personal story using, media that they may have never used before, and gives them a new platform to share their story and their experiences with others.
The goal of this workshop is to really humanize the participants and to give them an opportunity to tell their own stories, because the media has really stigmatized heroin addiction. And our objective is to show that these participants are human beings who face a lot of challenges, and they have really important stories to tell.
I feel like a better person today since I started the Salome project. I've rekindled some relationships with my family. I've made some attainable goals that I can. I've met a few solid people there that have been very instrumental in helping me get on the path to being a productive member of society. Maybe my message through the end of it, I can pass it on to somebody that they'll get something out of the experiences in my life that happened. If I can maybe reach one person and help them, then it's all worth it.
About 10 years ago, I was down in Halifax, and I'd left here on methadone, and I had it all arranged, my husband and I, to get to Halifax, and we'd be on the program right away there. We had it all arranged through Ottawa, and we got down there, and they wanted to put us into detox for 30 days, and that's terrible. Going off methadone into detox after 10 years of being on is really deadly. So we ended up, from a stable life, we ended up hitting the streets of Halifax, and I got hit in the head with a brick and mugged, and ran back to Vancouver as fast as I could when I got out of the hospital, and got into harm reduction. A quote I heard was, "If you don't tell your story, somebody else will, and you won't like it."